Hello everyone, in today's video, we're going to discuss about the first theory in AIDA2's freediving course. There are three topics that we're going to focus on. The first one is physiology and breathing for freediving. The second one is depth and pressure. And the third one is equipment for freediving. Let's start off with the physiology and breathing for freediving, which consists of the respiratory system, the circulatory system, and the mechanics of breathing. The respiratory system is a system made up of the nose, diaphragm, lungs, and air passages. Air travels in through the nose or mouth to the trachea, bronchi, bronchioles, and into the alveoli. From the alveoli, gas exchange between the lung and blood takes place. Let's continue with the circulatory system, where the heart pumps blood around the body and to and from the lungs. Blood transports oxygen around the body. Oxygen is carried by the red blood cells bonded with hemoglobin, and carbon dioxide is transferred back to the lungs carried in blood plasma. For breathing mechanics, the main muscle involved in creating these pressure changes is the diaphragm, allowing the lungs to inhale and exhale. And it is aided by the intercostal muscles, which are the muscles in between each rib, and all of the muscles around the chest area. Now, let's focus on the specifics, like how does the body know when to breathe, which is an important aspect in freediving. The urge to breathe arises when the CO2 level in the blood increases past a certain level, and not when the O2 level is too low, which is a large misconception that many individuals believe. This urge to breathe manifests as a burning sensation of the diaphragm, or otherwise known as abdominal contractions. When this occurs, your body still has O2 available to use, so you can keep holding your breath for some time. The best method to gauge your limit is to use the urge to breathe as an alarm. Once the urge comes, get ready for your ascent. With practice and time, you'll be able to extend your ability to hold your breath, enduring the urge to breathe. Let's proceed to hyperventilation. In freediving, hyperventilation is described as conscious or subconscious overbreathing. This does not store more O2, but it lowers the level of CO2 in our blood. This will delay the urge to breathe until the CO2 rises above its normal level. This is the reason why hyperventilation is incredibly dangerous. If you don't have the urge to breathe, you will not know how far you can go. Hyperventilation can accelerate the heart rate, metabolism, and reduce overall breath hold times, making it detrimental for your dives. Symptoms of hyperventilation include euphoria, tingling in the extremities, lightheadedness, dizziness, numbness around the mouth, a metallic taste in the mouth, or semi-paralysis of the hands. And most importantly, if you experience any of these symptoms, breathe normally, stay calm, and do not dive until they go away. Many may question how to prolong dives without the use of hyperventilation. There are two methods to prolong dives. The first is to increase your CO2 tolerance, which will eventually result in longer and safer dives. The second is to relax both your body and mind simultaneously during a dive, which will minimize the CO2 production, resulting in delaying the urge to breathe in a safe manner. Time to progress to the technique of breathing before and after a breath hold dive. We start off with belly breathing from the abdomen, making sure that you are relaxed, calm, controlled, and conscious of your breathing. It is recommended that your exhalations are longer than inhalations. Keep each breath deep and slow to avoid hyperventilation. Once you are ready to dive, ensure your final breath is complete. After resurfacing, take deep, quick, full breaths in. Relax passive exhalations afterwards for 3 to 5 full cycles. Lastly, we are going to briefly discuss a breathing exercise to improve your breath hold dive preparation and recovery. Lie down on your back and relax your body and mind. Inhale and exhale through the mouth while trying to focus on belly breathing. You will know it is effective when you feel your heart slowing down. Let's continue on with depth and pressure. There are going to be two topics that we are discussing, which are the effects and a general understanding about equalization. When we enter the water, the first effect our body notices is pressure. Pressure will increase at approximately 1 bar for every 10 meters of seawater. According to Boyle's law, if the temperature remains constant, The volume of a gas is inversely proportional to the absolute pressure. Our way to combat against the oncoming pressure is to master equalization. The body contains air pockets, notably in the ears, sinuses, lungs, and within the mask. Without the use of equalization, our body won't feel comfortable during any kind of descent due to the buildup of pressure around us. A side note, there is no need to equalize when ascending back to the surface. The best technique to equalize both your nose and sinuses is through the Frenzel maneuver. In order to Frenzel equalize, we need to create pressure in the oral and nasal cavity. We do this by closing the glottis, pinching the nostrils, then creating a seal with the tongue. Once a seal is secured, simply lift the tongue and larynx. Then compress the air in the mouth and throat, creating pressure in the oral and nasal cavity, allowing equalization in those air spaces. The remaining air mask, which could be equalized by a simple exhale through the nose. Methods to avoid equalization problems are equalize frequently and gently, slow your descent if necessary, never force an equalization, do not dive with a cold or congestion, avoid using decongestions, relax while you free dive, tuck your chin in and relax your head and neck, or wiggle your jaw to help clear any sort of sticky ear. The final topic we have is about equipment, which is self-explanatory because we're going to be discussing about the general understanding of the needed equipment to free dive. Let's begin with the freediving mask. It has to be low volume, which is smaller than a regular scuba diving mask, so it's easier to equalize. It has to be flexible, so it can be compressed more without being uncomfortable, and it has to have clear lenses to be able to see your body clearly in the eyes if you need to watch out for any LMC or blackouts underwater. A common accessory to pair with the mask is a snorkel, which would help with breathing on the surface or watching for your buddy when you're on the surface holding the buoy. It has to be flexible and rigid, and most importantly, without a purge valve. And make sure you remove it from your mouth as you descend to help hydrodynamics and protect you in case of a blackout. The first fin that we're going to talk about are bifins. They are longer and more powerful than scuba fins, allowing us to go deeper underwater with less time. They are full foot fins, and they could be made using different materials such as plastic, fiberglass, or carbon fiber. The second kind of fins are known as monofins. It takes different technique and takes time to learn it. They're more powerful than bifins, but they're not as maneuverable. Now let's look at the attire that we're going to wear during a free dive, which are wetsuits. They're ideally made to measure close to our body. They have an integrated hood. They're usually fitted as long johns or paired as high trousers and a separate jacket. There are no zippers for minimal flush to increase our hydrodynamics underwater. They are made from open cell neoprene for warmth and mobility, but their only con is that they are extremely fragile. To assist us in our descent, we may use accessories such as weight belts, which are worn on the hip rather than the waist to help deep breathing. It's rubber, so the belt stays on the hip whenever it's stretched tight. It has to be small and use hydrodynamic weights. It must have a quick release system in case of emergency. And it seals the suit so it will stay on the hip. And that's it for this video. Thank you for watching.